Welcome to the Mind Body Healing Channel audiobook series brought to you by New Bellum Research. This audio episode is the new Placebo Handbook. Chapter 6. Improving Placebo Response. As mentioned in earlier chapters, placebo responsiveness has increased in the general population during the past 3 decades. Americans in particular have steadily become better responders to placebo treatments. Researchers from McGill University in Montreal, Canada published findings in 2015 that while pain medications have leveled off in effectiveness, pain suppression in patients receiving placebo treatments has nearly caught up with pharmaceutical medications in their effectiveness at suppressing pain. We find that placebo responses have increased considerably over this period, but drug responses have remained stable, leading to diminished treatment advantage. The McGill University team concluded. The fact that the researchers included only rigorous double-blind studies in their analysis lends credibility to the data, since every patient compared in each study had symptoms and inclusion criteria similar to each other. An important fact about pain medications in general makes this trend especially surprising. While placebos have become more effective over time, pharmaceutical pain medications have become increasingly more potent, but at the same time potentially more dangerous and addictive. Yet the McGill team's research discovered that none of the new and more powerful drugs were significantly more effective than previous pharmaceutical drugs at controlling pain. This is an important finding considering that placebos have no side effects, and in some studies, placebos contribute 80% of the effectiveness of a prescription pain reliever. People who take pain-suppressing drugs for chronic pain expose themselves to serious potential side effects and possible addiction. Furthermore, because patients often experience a drug high when they take enough prescription medication to reduce pain, they seek higher doses when their tolerance to the drug no longer provides the drug high. Falsely believing the feeling of being high is required to achieve a reduction in pain, patients often seek higher doses within a few weeks of starting on a drug prescription. The patient never realizes that as much as 80% of their pain reduction is associated with their brain's own placebo response. For any patient who uses a drug to treat chronic pain, it may be prudent to consider substituting placebos for opioids like hydrocodone, oxycodone, and fentanyl, each of which is as addictive as heroin and cocaine. Even commonly used over-the-counter medicines like acetaminophen can cause kidney disease, while ibuprofen can cause bleeding of the digestive tract over time. For these reasons, placebo treatments should be considered as healthier alternatives to any pain medication. There are a number of techniques that can trigger an individual's placebo response. Ironically, many of these techniques are not commonly associated with the placebo response by the lay practitioners who employ them. For example, coaches of competitive sports teams know that if the team is motivated to win, they win more often. A coach will use emotionally charged language, facts about the other team's weaknesses, and strong calls to action to motivate a team before a game. When successful, the players become physically stronger, faster, and enter a high-performance mental state that some athletes call the zone. These actions are unlikely to be thought of as a placebo treatment by the team. But the effects they are seeking: a boost of energy, increased focus, determination, stamina, and even aggressiveness, links the ritual of the pep talk to improved physical performance, and can be viewed as a placebo response. Based on what we now understand of how the brain's placebo response is triggered by ideas supported by past experience and present stimuli, these improvements to athletic ability can be partially or wholly attributed to the brain's natural placebo response. Athletes in competitive sports that require an individual's performance be put to the test regularly tap the power of their brain's placebo response to work with great effect. Michael Phelps, an athlete who won 23 gold medals in Olympic swim competitions, has found the practice of cupping helpful to him in preparation for each competitive swimming event. A cupping treatment uses suction cups to draw a small amount of blood closer to the surface of the skin, in the case of Phelps, specific areas of his back. Practitioners claim the cupping technique helps reduce the buildup of lactic acid in the muscles after a workout, promoting a faster recovery from a hard workout. From a Western medicine point of view, cupping has no effect whatsoever in metabolizing lactic acid from muscles. But from Michael Phelps's point of view, he holds the record for the most Olympic medals ever won by an athlete, and his long history of cupping is an effective treatment that contributes to his success. Michael Phelps is likely an example of someone who has successfully hacked his brain using a placebo. Whether or not his placebo response improved over his career is not known. But what is certain is that he has achieved phenomenal results by intentionally taking actions that are supported by placebo research. Numerous studies have concluded that placebos relieve muscle tension and improve a patient's ability to walk, run, and even become pain-free after chronic suffering. As described in Chapter 1 as far back as 1799, John Haygarth reported that placebo treatments can alleviate muscle pain and stiffness. The group of symptoms that have been successfully treated with placebos has only grown larger over the years as more clinical research is published. The following is a partial list of symptoms that have been clinically investigated and treated with placebo: agitation, anxiety, back or neck pain, breathing problems, congestion, constipation, cough, depressed mood, difficulty concentrating, dizziness, drowsiness, fatigue, headache, IBS, overactive appetite, insomnia, irritability, joint pain or stiffness, memory problems, muscle pain, muscle weakness, numbness or tingling, painful menstruation, palpitations, reduced appetite, skin rash, thoughts about suicide, and even tremors. It is critical to not mistake placebo treatments for cures for known health conditions, which are often the root cause of some of the symptoms listed above. Sometimes, these symptoms are connected to underlying conditions that should be treated by a physician. It is important that you seek medical care from a physician whenever you experience any symptoms or conditions that linger without explanation. However, for many people who suffer from the conditions listed above, physicians are unable to identify an underlying condition, informing their patients that their symptoms appear to have a nonspecific cause. Placebo treatments can be helpful tools for understanding nonspecific symptoms. They can also be viewed as diagnostic tools with no side effects. If a patient's response to a placebo treatment concludes with a positive outcome, there may be no reason to seek an alternative intervention. For placebo responders, placebos could be accepted as standard care for symptoms with nonspecific causes. Investigating your health with placebo treatments can keep you focused on your wellness as you reinforce your desire and intention to stay well. Some people don't require a treatment to tap into their brain's placebo response. History is full of stories of spontaneous healing influenced by nothing more than belief, sometimes reinforced with visualization. Regardless of whether physical responses to faith healing in humans are delivered by a supernatural power or not, it is worth noting that each of these stories includes elements that are known triggers and reinforcements of the brain's placebo response. A person we define as a placebo superresponder is not very different from the rest of us. A superresponder simply means the individual has responded to a clinical placebo treatment faster than other people, sometimes overnight. Depending on the intensity or type of experience that triggers a placebo or nocebo response in the brain, every human has the potential to respond to placebos and nocebos. Their brain's physical wiring and human experience since birth reinforces such responses. It can be argued that we are all capable of being superresponders to both nocebos and placebos, depending on the significance of a given experience. That's how humans have survived for millions of years. When alerted to possible danger, your brain has evolved to favor a survival strategy that takes action, even if it turns out there was no danger. Likewise, it is better to anticipate healing from a serious injury than telling yourself that you might not make it and give up. When your physician calls you into the clinic to announce your lab results, especially if the results could mean living or dying, many people will anticipate the possibility of bad news by overloading their bodies with stress hormones. Such a mental state is primed in the brain to receive a nocebo. You probably know the feeling. Even though you can't be sure you are about to receive bad news, your brain has already anticipated that possibility and has already taken action regardless of missing all the facts. This action can be felt throughout your whole body with physical measurable responses. When your physician announces you are perfectly fine, and the anticipation of bad news turns out to be good news, you immediately begin to feel relief with the corresponding physical responses throughout your whole body. It's easy to say, of course, to this example, the patient was relieved to hear the good news. But think about it, your trust in the doctor, the lab, and everyone in between is the only fact you have that proves you are healthy. But your brain has no need to understand the chemistry of a lab test to initiate physical changes in your body. When the physician gave you good news, you began to feel better immediately because of your confidence in the expert. The social consensus that lab tests are almost always accurate, being in a supportive environment when you hear the news and your hope that events will now begin to unfold as you want them to. In this example, good news cures bad news. Over time, you can learn to extend your brain's natural ability to help you reduce chronic pain, muscle stiffness, nausea, nervousness, insomnia, and many other conditions that respond to placebo treatments. You may accomplish this by crafting a ritual to help you resist nocebo thinking and follow a prescribed placebo treatment that consistently and repeatedly targets known response triggers.